Registered Kinesiologist of Couchiching Family Health Team. Today I want to talk to you about prenatal exercise. I'm going to walk you through a series of exercises geared towards keeping your body strong as we go through the so many incredible changes that happen with pregnancy, as well as emphasizing that exercising is a very important part of a healthy pregnancy. Before starting an exercise routine, always check in with your primary health care provider or whomever is providing that care for your prenatal care. You always want to make sure that exercising is safe for you, and especially if you aren't used to exercising, make sure that you're checking in before you start a new program. On top of what I show you today, it's also very important that we think about keeping the body healthy and keeping up exercise for the cardiovascular system. So walking is a very great exercise for that. I encourage you to keep walking or start walking if that's something new for you. But it does keep both ourselves and our baby healthy as we progress through our pregnancy. I'm going to start by showing you 3 strength exercises, followed by 3 mobility exercises. Strengthening exercises are very important to help us provide support around the pelvis and the spine as our bodies expand and start to accommodate a growing belly. As well, those joints will start to become a little looser, a little less stable, so that strength will be a very big key part of that. Mobility exercises can offer us some relief for when we have those tight, fatigued muscles from carrying excess weight or extra weight as we go through our pregnancy. And sometimes there's just some new aches and pains that we're not used to feeling, and these can often give us a little bit of relief from those. The first exercise is an abdominal brace. The abdominal brace is an activation exercise of the muscles that support our belly. As our muscles expand, it's very important to keep them strong. Sitting in a chair, we're going to sit nice and tall, keeping our spine nice and long, and letting our low back relax. Oftentimes, as we carry increased weight through the front of our body, our spine will want to curve or increase that arch in the low back. We want to keep that relatively minimized, so we let that tailbone relax towards the chair. We're sitting on our sit bones. As we sit here, we're going to activate the lower abdominal area. We're going to think of the muscles from the bottom of the belly or from the front of the pelvis, starting to drop upwards and towards the belly button. So our muscles are doing the work, and we're maintaining this hold as we continue breathing comfortably. It's very important to keep that breath coming in and out. And then we're going to relax slowly. As we do this, if you feel like you need a little support on the relax, you can place your hands under the belly. So we'll repeat a couple of these in a row, holding for a couple breaths. We start to draw that belly up. Hold, breathe, let it go slowly so that we're not letting the belly drop quickly. From the side, as we sit here, we're going to think of those belly muscles drawing up. You can see how my belly starts to lift away from my thighs, away from the floor, and then we let it relax down slowly, and that starts to fall again. You want to repeat repetitions of this. Take your time, do support the belly if you need to, and keep it comfortable. The next exercise is a squat. The squat's a very, very important exercise to keep the glute muscles strong, keep that support around the hips and the pelvis. This will serve us well as we carry increased weight, as well as come time for the delivery room. I have a chair behind me for support, so I do encourage this. Even better, push it against a wall so that it can't slide on you. This makes sure that if we lose our balance, we have something there to catch us. We're going to plant our feet hip width apart. As we're standing tall, we think of that nice long spine position. We can engage those core muscles that we just talked about in the last exercise. And then we're going to shift our weight back. Our hips start to hinge down towards the chair. We can lower all the way down to rest, or we can hover and come on back up, using those glute muscles, using those buttocks muscles to bring us into that lift position. We can repeat this, and we're maintaining that nice long spine position. We're not overloading the knees, and we have the chair there for safety. Our final strength exercise is going to be down on our mat. So we get you down into a comfortable position on something soft. If you need to, you can perform this in your bed as well. I'm going to get you in a side lying position. We've also added a pillow. So with the pillow, we're actually going to use this to support our belly if we need to. You can grab an extra one for your head if you need as well. Once we get you into that side lying position, then we'll go through the exercise from there. Once you're in your side lying position, you can use the pillow to tuck under the belly and provide a little bit of support. Especially as you go along, this position may need that extra support, so just get as comfortable as you can. With the hips and the knees stacked, my knees are bent to about 90 degrees, hips are bent to about 45, and my hips are fully lined up on top of one another, so it may feel a little bit like you've rolled forward. Keeping those heels together, we're going to start to lift that top knee, activating those glute muscles once again, providing support around the pelvis. One thing to watch for is that that hip doesn't roll back, the belly doesn't lift off of the pillow. We're keeping that nice neutral position through the spine, and just our hips are working. While we're on our mat, we're going to go into our mobility exercises. Keeping movement happening around our hips and our spine can give us a little bit of comfort, especially for those aches and pains and tight muscles that are working a little harder these days. From this position, we're going to go into a hands and knees position. I suggest widening the knees almost to the width of your mat or wider than hip width apart. We're going to expand our hands just slightly. We also have the pillow here for support if need be. My toes have turned in slightly to keep our hips open. And we're going to start to sink our hips back towards our heels. The knees are wide to allow room for our belly, and our head relaxes fully onto the mat. If we don't quite reach the mat, or if this is uncomfortable in any way, we can bring the pillow there to support us. Slowly bring yourself back up and ease out of the exercise. Our next mobility exercise is called a hip flexor stretch. We're going to be opening through the fronts of the hips, keeping those muscles moving. From this position, we're going to come up on our knees. We're going to use our pillow again, this time for a little bit of comfort under the knees. And we're going to bring one knee up in front. As we're in this nice tall position, we can encourage that activation of our abdominal muscles. We can also support the belly with the hands if need be. We're also giving a little activation around the hip muscle into the buttock to give us this openness through the hips. If you start to feel a little bit of tension or tightness through the front of the hip, that's what we're going for. If you need a little bit more, we can let our hips start to move in without losing that low back positioning. We're keeping nice and long through the spine. Also, to continue to expand, we can take that arm up and overhead. We're reaching with the same arm as that leg that's below us, and we're increasing that stretch up into the abdomen just slightly. For our final stretch, we're going to come back into a seated position in our chair. We've come off of the floor. We're going to be stretching out some of the muscles of the hip once again. This gets into our glute and piriformis muscles. Once again, always thinking that good posture, nice and tall, nice and open, and elongated through the spine. As we're seated, we're going to take that ankle and cross over the opposite knee. We let the knee relax and fall out towards the side. We're maintaining that tall position through the spine, and we should start to feel a little bit of tension or tightness through the hip. If we're not feeling as much, we can start to move into this a little bit if tolerated. And keeping that spine long, we allow the body to start to hinge forward, and we can get a little bit more of a stretch. The nice thing is, with the angle of the hips and the legs, there's room for our belly to move in between. We can hold this, take our time, ease back out, and do the same on the other side. I wanted to thank you all for joining me today to try out and learn some new exercises that we can use throughout our pregnancy. I wish you all the best through your pregnancy, and should you have any questions about exercising during this time, I do encourage you, please follow up with your family doctor or your care provider that is helping you through the prenatal time. Thanks so much, and enjoy your day.